be honest, managing phosphorus is one of the most challenging aspects of my job as a kidney doctor and as a medical director of a dialysis unit. And it really takes a village. It takes the physicians, the dietitians, all of the providers, and the patients. We have to work together very closely. And so it is of the utmost importance that we have access to every single therapy available. We need to give our patients a fighting chance. And so these are the therapies that are now available. And if they are limited, this really could be detrimental to our patients.
When I think about my time on dialysis, I want you to pay attention to this. I did dialysis 10 and a half hours a day, 7 days a week. That ended up being 294 hours a month, 3,528 hours a year, 14,112 hours for the 4 years that I was on dialysis. You can't get that time back. This is why when we're talking about, trying to protect the patient's rights, access to care, and the quality of life, it is very significant that you are here today listening to us. So to kind of answer the question, the moving coverage for oral-only phosphorate-lowering therapies into the bundle will restrict patients' access to care and increase the out-of-pocket costs, disproportionately impacting minoritized communities and low-income status Americans who are already battling not just chronic kidney disease, but the comorbid conditions with that.
3 times in the past, Congress has passed legislation to prevent these oral-only therapies, these phosphate-lowering therapies from going into the bundle. But that lapses, that delay ends very soon. And so starting in January 1st, 2025, these phosphate-lowering therapies are cited to go into the bundle. And so unless Congress reauthorizes the delay by passing the Kidney Patient Act of 2023, then these oral-only phosphate-lowering therapies will be moved into the bundle.
The dialysis center gets paid for it whether the patient gets the medication or not, right? So everybody gets it, whether they actually use it or not, right? And so it becomes more expensive because you're giving it to everybody as opposed to giving it to the person who actually needs it. That's the logic that we're talking about here. And that's why I said I don't understand what CMS is doing, right? Because it's illogical, right? It doesn't save money the way they're doing it. That's the point. And the other side of it is it's also elevating patient risk at the same time. Completely illogical, right? And that's why the law is important, right? Because sometimes they get it wrong. And so Congress looked 3 times and said, you got it wrong, but they didn't hear, so we got to do it one more time to help them understand.